Good afternoon, everyone, and welcome back. My name is Andrew Hoffman. I'm a wealth manager in Charleston, South Carolina. And the purpose of this video today is to actually educate you on how you can take control of your own health care. I want to show you a simple tool that will allow you the ability to actually compare your own Medicare Advantage plans in your specific area. And we're not going to be utilizing the insurance companies to do this. We're actually going to a very unbiased resource because we're companies. So you ever wonder if you got the best plan? If you ever wonder if you're saving the most amount of money possible? Typically folks who are on Medicare or on a fixed income, right? We got to really make sure that we can make our dollars last as long as we can, and we can't be losing money to prescription drug costs or to high out-of-pocket costs or premiums. So we want to make sure that we're getting the best bang for our buck. So by the end of this short video, you will actually know and understand how you can research your own Medicare Advantage plan, also called Part C. So I'm going to show you on the Medicare website where you can actually do this at. So here's really the current problem that we're facing today. And one of these main problems is that plans change every year. Every single year, we have the annual enrollment period from October 15th till December the 7th. That's when the new plans actually come out. Well, these plans change. You might be on a plan right now, but more than likely, you're going to get a new outline of coverage or schedule of benefits, and you can see that the premium changed or your deductible changed. So you want to make sure that you have the best value. So a good idea is to kind of shop those plans. The problem is it's hard to find out all the benefits and features of all the plans. If you go to United Healthcare, they're going to tell you they have the best plan. If you go to Cigna, they're going to tell you they have the best plan. And it's the same for all the insurance carriers. So we need a very unbiased resource to accomplish this. So with solicitations from different companies, you don't really know who you can trust, right? You might be one of these fortunate people that you have somebody locally or even somebody that you could talk to on a regular basis that you trust, but not everybody has those people in particular healthcare or insurance industry. So I want to show you how you can take charge, right? So we got a current problem. Let's find the solution for it. And the solution is education and teaching you on how you can know you can make a good decision. So here's the step-by-step instructions. After we go through these step-by-step instructions, then I'm going to kind of actually show you how to use the tool on the Medicare website. So we're going to go to www.medicare.gov. It's very important that after you put this into your search engine up at the top, that more than likely Medicare website will not pop up to the top. You're going to see companies who have paid for the top of the Google or the Bing results to be first, to kind of get you to click on them. So make sure you kind of scroll down the page that you do find the Medicare.gov website. Once you're on the Medicare.gov website, the first tab on the left-hand side is going to be Sign Up and Change Plans. From there, we're going to scroll down to where it says Find Health and Drug Plans. And then we're going to answer 3 questions, which I'll show you. We're going to enter our prescription. So we've got a very personalized and detailed plan for us. We're going to choose a pharmacy. So if you have a preferred pharmacy, we want to make sure that they have your prescription drugs at the best value. We're going to select health plans with drug coverages. Next time we'll be actually looking at just prescription drug plans, but today we're exploring Medicare Advantage and prescription drug plans combined. The next box is compare health plans, compare drug coverage, and then enroll. So let's walk through that process. And once again, make sure that you go to the one and only Medicare.gov. And here we are, the official Medicare.gov website. So what we want to do is we want to actually compare plans on the Medicare.gov website. Once again, make sure that you are on the official Medicare.gov website, and you'll notice that at the very top. We're going to go over here to the left, use the first tab, Sign Up and Change Plans. Scroll down to where we actually see Find Health and Drug Plans. So click on that. And then we're going to get a personalized search. And in order to get the personalized search, you're actually going to have to put in your zip code or where you're located at. So we're going to go to Basic Search. I'm going to type in a zip code here for Charleston, South Carolina, and hit Find Plans. Now here comes basically 3 questions that they want to actually get for me is step 1 of 4. But the first question you see is how do you get your Medicare coverage? Some people might just have Medicare Original, or you might already have a Medicare Advantage plan you want to compare. This is actually where the government is trying to gather as much data from you as possible. For our example, I'm going to keep it short and sweet and just say I don't know what type of coverage I have. You can also enter if you receive state assistance. If you do receive state assistance, I advise you to actually click that you do get help. That way it'll illustrate the subsidized premiums that you get assistance with. Once again, for our example, I'm going to click I don't know. The last question is, would you like to add your drugs? Yes, I would, because what I want is I want to find not only the best drug plan, but the best health and drug plan for my specific situation. So I'm going to put I would like to add those drugs. Step 2 of 4 is to actually enter your prescription drugs. This is where we're going to get even more detailed for your situation. We want to make sure that the plans match up to your medications. So if you don't take any drugs, you can click that, but I'm going to put in 2 medications here. The first one is lisinopril, which is a very common blood pressure medication. So you can see if I just type a little bit, it pre-populates. You then can choose what the dosage is as far as like the specific milligrams that you might be taking. Then you're going to actually select the quantity. So whether you're taking 30 in a month or 60 in a month, you can be very specific. And now I'm going to add another prescription, which is metformin, a very common and generic diabetes medication. Once again, review the dosages, make sure you have the correct dosage, make sure you have the correct quantity for your specific situation. Once you've done that, hit add drugs and dosage. And now I have 2 particular medications on my list. And of course, if you want to add others, you can do that. Just after you've done it, make sure you review down here at the bottom that you do have the correct ones. If you don't, you can actually take the action button and change those right there. Since my list is complete, I'm going to click my drug list is complete, and I'm on step 3 where I'm actually going to select a pharmacy. So what this allows me to do is actually compare 2 separate pharmacies at one time. So always kind of give you an idea of who's got the best prices for your medicines. I want to expand the area that I'm at. It's only showing a half a mile, so let's show 4.5 miles out from my home zip code to give me a larger span of pharmacies. I'm just going to use 2 common or popular ones here in the Charleston area. One is CVS, and the other is going to be Walgreens. So once I've added these 2 pharmacies to my formulary, I've got the 2 pharmacies that I'm going to be able to compare. I want to tell them that my plan results are completed there, and I want to continue. So the next thing is to basically to let me know that they found a couple different things. They have prescription drug plans. They have Medicare Advantage plans with drug coverage, which is what we're looking at. You can see that there are actually 19 plans in this area. If you have certain elements that you would qualify for, make sure you click those elements. Let's go ahead and click on Medicare health plans with drug coverage and then continue to plan results so I can see the 19 plans that are available. The first thing that pops up is actually Medicare. This is just original Medicare. These are our results. We don't want that. We actually want to see what the insurance companies will provide. So we're going to go ahead and minimize that. So now we have our 19 companies in this particular area that are based upon the prescriptions that I had and also on the 2 pharmacies that I actually chose. So there's my summary of those. I want to go ahead and show all 19 instead of just the top 10. And now you can see here's the list of the healthcare plans. So the first one up is Aetna. The first box on the left is estimated annual drug cost. Then we have monthly premiums, deductibles, health benefits, drug coverage and restrictions, estimated annual health and drug cost. This is just a number that they basically have set as an estimate for what your cost would be. You can click on this and it just tells you an estimate of your plan benefits, the cost of your premiums, your co-payments, your deductibles. By no means is this what you will pay. This is just throwing out some random health events that could happen. But it's important to understand that this formulary is listing these according to your estimated annual health and drug cost. And you can change that, but here is that. It's $29.10 with Aetna. WellCare is $29.80. And the further that we scroll down, it gets more expensive, 30, 40, and on and on and on. Remember, these are estimated numbers for random healthcare events. This doesn't mean that this would be what your costs be. On the left-hand side, you can see it actually shows the estimated annual drug cost. So it's taking out healthcare, it's just looking at prescriptions. This formula is basically showing you what your cost would be today. Is if you enrolled today, what your cost would be starting the first of the next month. There's the monthly premium for drugs, which is $0. Here's my deductible, which is $95 for my prescription drugs. And then one of the more important things that you actually want to look at too is what is your estimated or your max out of pocket. So if you really had a situation where you went to the doctor in the hospital quite a bit, there are your limits. You could spend anywhere from $10,000 out of network or $5,900 in network. WellCare, once again, has a monthly premium of $0 also, but then look at these out-of-pocket costs, $6,700. If we scroll on down to the bottom, we'll find some plans that actually have a monthly premium. Here's Humana, $45 a month. The prescription drugs, if I pick them up, the total would be $101. That's for the whole year. So not just for a month, based upon the whole year of what my cost would be. So once again, starts the first day of the month after you enroll. So you're able to kind of go down here and compare all these different companies. Here's United Healthcare, $38 a month monthly premium, and here's their out-of-pocket expenses. So as you can see, $0 is not necessarily the hero. Just because your monthly premium is $0 doesn't mean that you have comprehensive coverage. You could actually end up paying quite a bit out of your pocket. Might be a $0 monthly premium, but if you end up paying $10,000 out of your pocket, really what has happened? Once you found this out, here's the great thing about it is you can store this information. If you keep this drug list ID and you keep your password date, which is basically the date that you did the comparison, you'll be able to log back into the Medicare website and pull up this list without putting in your prescriptions, without putting in your pharmacies. So it's important to kind of keep that information handy right there. So here is our Aetna plan. If that's the plan you like, you would just click enroll and you're all set. You would be up and going for that plan for the calendar year. Once again, make sure you're on the Medicare website. This is probably the most important thing that I would tell you, just so that you are not getting bombarded with solicitations from all kinds of different healthcare providers. I hope this has been beneficial for you today. I hope that I've actually showed you how you can empower yourself and educate yourself to make sure that you do have the best plan available. You don't have to rely on someone else. But if you do have questions, we're happy to help at CompareMedigapCompanies.com. There's our webpage and also our email address for information. Once again, my name is Andrew Hoffman. I'm a wealth manager. I appreciate y'all's time today. I hope everybody has a great week and good luck in the enrollment periods. I want to make sure that we're getting the best information possible when not being influenced by individual insurance companies.